So we do have Dr. Samuel Essien, Baidoo, microbiologist with the University of Cape Coast, but also integral related issues of testing. And we have to straight away talk about what we're seeing under the microscope. Good morning to you, Dr. Essien Baidoo. What we're seeing under the microscopes it gives you, the scientists, the confidence to say that this is under control so far?
Good morning, Roland, and good morning to all your viewers. I think so far, so good. From everything that has happened so far, it's been wonderful. There's a lot of work that has been done by Noguchi, KCCR, in making sure that we understand the dynamics of what we're doing in terms of the testing and all of that. And I'm sure you're also aware of the breakthrough research from WAPIP, where we've been able to sequence genomes of the virus that we have in our country. So far, so good.
Now, how important is it? The president mentioned that in his speech, and you could see that immediately he said that his lips or his face just lighted up a bit. How important is that?
It is very important because if we understand the dynamics of the virus that we're dealing with as a country, it also helps in further research to unravel and facilitate therapeutic interventions as to what we should be looking out for in terms of vaccines or treatment regimens and guidelines as a country. So this is very, very important and a very good news to all of us.
But the reality is that when it comes to the crunch, those who walk the streets, those in those difficult situations, and Dr. Letitia Appiah here had been talking about those who live hand to mouth. And we all do know that people need to survive. Now, while we see at the research side good news, we also do know that that has to translate in their livelihoods. At what point in time do we need to make sure that they need to do what is right? So that what you see there in the scientific field or in the laboratories, really, you're hoping that will give you comfort based on what you see on the ground.
I think at all times, Roland, we need to ensure that everybody complies with the laid down protocols, particularly with regards to issues relating to social distancing, isolating ourselves, hand washing and personal hygiene and all of that. Now, there are two key things here. We have what we call the transmission frequency and the transmission efficiency. Now, for the transmission frequency, that is the cycle at which an infected person infects the next person. Now, if it becomes so short, what it means is that we'll have a larger number of people becoming infected within a very short period. Now, the efficiency is about people who are able to have or possess the virus and then would have the tendency to transmit the virus to another person, whether they become active carriers or they become asymptomatic and all of that. Now, if you put these two together, basically, all of us need to come together to ensure that the strategies that have been put in place to mitigate the spread of this virus is adhered to completely by all of us. Now, we need to make sure that we break the frequency of transmission, and we also need to make sure that we minimize the efficiency of transmitting the virus. So what it means is that we need to isolate ourselves, we need to distance ourselves, we need to wash our hands regularly, we need to make sure that we practice all the hygiene tenets that have been laid out, we wear our face masks and all of that, and then we should be good to go in bringing this curve down properly.
Now, I have to now get to you, Dr. Appiah. When you say that, oh, treatment of COVID-19 is simple, what really do you mean on the clinical side?
Yes, what I'm trying to say is that now the preventing, as Dr. Essien Baidoo said, is just adhering to the protocols. So that is, we know that. We know what to do to break the transmission. adhering to the protocols of social distancing, hand washing, wearing your mask, and then, isolating yourself and keeping away from each other, non-essential contacts. That is what we have now. They're in the lab sequencing the genomes to make sure that they can have vaccines for us so that we do not have to get into this social distancing. We're not doing that for either viruses because they are vaccines. But that is what the scientists are doing now. So whilst they are getting ready and they're doing all they can to get us vaccines and medicines to break the transmission, what we have to do is to do the social distancing in wait for them. It is important that we appreciate it, that they are doing this on our behalf, and what we can do to make them fulfilled is to adhere to the social distancing norms and all the protocols so that when the vaccines are there, we will still be alive for them for us to have the shots, and then we can move on with our lives.
Dr. Essien, what you scientists are doing, how does that translate to the pharmaceutical sector locally?
So I think for now, locally, what we do know is that we have been able to sequence the genome of the virus that we are dealing with, and from the work that has been done at WAPI, the similarity between what we have here and what started from Wuhan and elsewhere, it's that high. What will happen basically is that we now have to study the other dynamics of the virus in terms of the formulations that the pharmaceutical industries will come up with as to what we actually need as an active ingredient in whatever formulations we have to target the virus and then knock it off once and for all. And I think that is the biggest breakthrough we've had as Africans and then as Ghanaians.
And I know that you trained in China, so perhaps you know the socio-cultural norms of the Chinese better. But you see that since the middle of February, they've had their cases very much stagnant, if not the beginning of March, so to speak. I think that's more appropriate. And rather, we've seen cases spiraled into big numbers that have become a concern to all over. In America, elsewhere in Europe. But just about 2-3 days ago, we just had some extrapolations made, even the WHO also in support this morning, that we could have some cases, about 300,000 affecting Africa, etc. If you read or observe all these that are happening, what keeps us and makes us different in Africa and in Ghana? And I asked the same question also to Dr. Appiah, so I want your views on the subject, Dr. Baidoo.
Okay, thank you, Roland. I think that when the infection started in China, there were two key things. One was that there was aggressive testing and expanded testing. So testing sites were expanded, new facilities were built. Aggressively, they tried to break the transmission efficiency. So the frequency at which people became infected slowed down with time. And I think that the whole world, particularly in Africa and Ghana, we've learned a lot of lessons from what happened in Wuhan, Italy, USA, and the likes. And that is what has translated into the measures that we have put in place to mitigate the spread of this virus.
And Dr. Appiah, you say that our population is also critical to this. We don't have too many of them clustered, do we? Dr. Appiah, I'm talking to you.
Yeah, you don't have too many of them clustered. Well, yes, yeah. Population density is critical in the COVID because it's through droplets, and now we're talking about aerosols, and through coughing and sneezing, and so the closer you are to each other, the easier it is to transmit. And if you look at the other countries, for instance, if you look at Sweden, look at the other places where in Sweden there's no lockdown. If you look at their population density, it's really sparsely populated. And so they're doing some kind of social distancing even in their calmness. And so that really also is important in transmitting the virus.
Okay, Dr. Baidoo, as we now try to wrap up this discussion, the decision taken by the president, of course we can fight it. All over, coronavirus is always an economic and a political issue, so that's on one hand. But going forward, are we likely to see a situation where if we have hotspots increasing, cases being recorded in particular areas, then we need to go in for the jugular, perhaps shut areas down in between, not nationally, etc., or just communities, and so then we can do the isolation?
Okay, I think that epidemiologically and demographically, these factors need to be monitored carefully. I think the approach so far has been, what do we need to do to break transmission? What do we need to do to limit the number of people that have become infected? And this approach is very, very important in that lifting the lockdown partially does not mean that all those other factors or approaches that have been laid down earlier on would be taken off the table. Now, what we need to do is basically to adhere to the approaches that have been put in place. So the first one is to break transmission, and we make sure that we adhere to all the hand washing practices, wearing of the mask, washing our hands and all of that, disinfecting and all that. And then number two, we need to also encourage people to honestly report signs and symptoms so they can get tested and managed appropriately. Now, the situation where we are likely to have people stigmatizing others who may have had the infection is likely to prevent people to honestly report. And in that case, what will happen basically is that these people will get threaded into the communities and continue to spread the infection. So the second approach would be for us to make sure that we encourage people, educate people to honestly report signs and symptoms so that they can be managed appropriately. And then the third approach, which I laud the government for, is the expansion of the testing sites. Previously, it was just 2 sites, but now we have additional sites, the reference laboratory, the public, and also might turn our time off the testing procedure so that such people can be identified early and then managed appropriately. And again, I want to add that we need to also enhance our surveillance systems, where we have a team in place that is monitoring the contacts that have been traced, whether primary or secondary contacts and all of that. That is very important in making sure that we mitigate this pandemic entirely.
Well, Dr. Appiah, now we've come to where we are. Everybody's thinking life has returned to normal. I mean, realistically, you manage related issues at the National Population Council. Is our life back to normal?
No, Roland, not at all. Our life is not back to normal. We were on lockdown so that we can break the transmission, so that we can do the self-isolation. The main thing is to break transmission, and also those who have the virus isolated and treatment. So we are not still in normal times yet. We just been left up a little, so we will not starve. We will not starve of hunger whilst trying to deal with the virus. And so, as the doc said, it is important that we work with stigma. We really have to work on stigma and make sure that those who have the symptoms are out and then for isolation. Yes, now the treatment sites will be all over in the regions, and so should isolation sites be. Because if you identify the cases and they are in the communities and they are in compound houses, they need to be isolated and treated before they come back into the general community, and they need to be comfortable in isolation. So the treatment, the isolation sites, and stigma should be something that we should try and really get out of our system. Because we have a lot of the surveillance people standing by to make sure that they identify the cases, active surveillance, and then the normal surveillance when they come to the facilities. So the surveillance, isolation, and stigma should really be dealt with then in no time we can get rid of this and make sure that the scientists also take their time to get us the vaccines that do not only work but also safe for the population.
Now, Dr. Baidoo, if we look at the perception that we tend to have right here, and socio-culturally, how we seem to think that because I'm not infected or we don't have the numbers, then it gives us confidence. It also means that gradually we tend to forget what the cautions are, what the guidelines or the protocols are. It will also mean that people will see it as just a normal thing. Now, scientifically, when do we psychologically need to see this virus as just one of those that are inherent in public health, so to speak? And so we just take it as coolly as it is and not as an emergency. At which point in time should we be doing that?
Not until we have a credible vaccine or an authenticated therapeutic agent that can deal with the vaccine. I think that education is key. We need to continuously educate people about the virus, the mode of transmission, and how it spreads, and all of that. We need to tell people about all these, what is happening in other countries and all of that. I think we've started a very good thing by using people who have recovered from the infection as mouthpieces in educating people so that we could minimize the extent of stigma and all of that. We need to continuously engage the public. We need to drum home the education on the spread of the virus and the fact that you can have it. You can be asymptomatic and so may not show any signs and symptoms, but you can become a conduit to transmit the virus to other people. And that is very, very important. So we need to continuously educate people on the transmission of the virus and make sure that we do this and we make sure we get a vaccine or a therapeutic agent. And then even after that, we need to make sure that we encourage people to keep safe, practice personal hygiene and all of that.
And Dr. Pia, we can have people who are asymptomatic, as we call them, but may not necessarily get to the stage where they are exhibiting the signs until they recover.
Yeah.
Okay.
Yes, that is why outside you're testing the antibodies. The antibodies tells you that the virus has been here. You've had the virus and you've recovered. You know, the immune system is very, very strong and very efficient. And so a lot of the cases, you may not even know that you have the virus, but then you can be a conduit to give to somebody else. So you can, if you do not take care of yourself very well, you can go ahead and infect your grandma, your uncles who have some comorbidities. That is why we all have to protect ourselves. And for me, the hand washing and this hygiene etiquette does not only prevent COVID, it prevents so many other cholera can be taken care of, and so many other infections that would really help our NHIS. So it is important that we stick to those protocols, and hand washing with soap and running water should be a common thing. It should be something that, in fact, we should have been doing that years back. So it's a habit that we should cultivate. Coughing in somebody's face, it shouldn't be just for COVID, but it should be something that we should, it should be a habit. It should imbibe in us, and we should start from the schools. So now with COVID, it should be in our curriculum in kindergarten. Hand washing, don't look in somebody's face. So we grow with it. So in case there's a COVID some other time, it will not, the impact will not be so felt so greatly.
And Dr. Essien Baidoo, what lessons have we learned by way of education for research and development, policy direction, and then also maybe among the population?
So I think one of the biggest lessons we have learned is our preparedness for future pandemics. There's been a lot of talk about funding research in Africa and in Ghana especially. There's a bill in Parliament on research funding in Ghana, which is still lying in Parliament. Imagine if this pandemic had happened and then we had about 10 or 15 Noguchi-like or KCCR-like facilities. We would have had expanded testing sites and all of that. If we had other centers where they could do genome sequencing and all of that.
And also working closely in research, especially in these times, and has been very much involved in all this. And he also works with the University of Cape Coast, teaches there as well. So anytime that we want all this, we can always go to him. Thank you for having you, Dr. Samuel Essien Baidoo. And also we've had Dr. Letitia Adelaide-Appiah, Executive Director, Executive Boss, National Population Council, always telling us that, look, we need to make sure we keep the protocols within the distance, and it means that husband and wife will cry. If you're in the hall, you sit at one end. No. It doesn't mean so, right? Well, thank you very much, Dr. Letitia. And look, we were happy that you've also been able to educate us. She is Executive Director of the National Population Council. We have to take a break, but please make sure you keep this conversation going on based on what you've learned. And these learning outcomes should better educate us and put into practice. Get interactive. Facebook, JoyNews on TV. We have a Twitter handle at JoyNews on TV. And when we mention them, make sure you follow us. So Facebook, follow us. Follow us also on Twitter, and then subscribe to us on My Joy Online TV on YouTube. Now, click notification buttons so that when we upload videos, we post things for you, you can get those notifications and access them, okay? All right, we're taking a break. When we have the next segment, we'll tell you all you need to know right here, Great Education on the show.